didn't really go out and do that much stuff. But because this year the APA was actually in Los Angeles, I was like, okay, well, since I'm here, I need to go out and do stuff every night. And so that was the difference. Like pretty much every night I went out and I was doing things, networking, meeting people. I also gave a talk as well. So I think that definitely added to things. Giving a talk makes a huge difference because I was way more invested than if I would have been if I hadn't not given a talk. So yeah, so my talk was pretty much on social media, on all of this stuff, basically going live, being able to have an audience, being able to monetize, all of that stuff. That's what that talk was on. So back in NY, I'm literally only back in New York for one day, and then I'm traveling again. I have some plans for this weekend. So I'll be going. I'm doing a friend's like a birthday trip to the Hamptons this weekend, and then I'm going to another conference on Tuesday. This one's in Vegas, and it's called Psych Congress Elevate. And this conference is pretty much more of a psychopharm heavy conference. And there's going to be, it's not just psychiatrists, it's a lot of psychiatrists and psych NPs. So yeah, a lot of travel plans that are coming up. But it's kind of unfortunate because I'm not a big traveler, honestly. Like I like chilling and not doing things. So it's like, oh man, like I got to go and travel again. But yeah, you got to do what you got to do, right? Yeah, we make the most of things. All right, so your nightmare asks, how can you tell the difference between something sad happening versus something traumatic? Traumatic lasts longer than sadness. Sadness is like a short time. Trauma is much more of a longer time. And it persists rather than just lasting for a little bit. Do stimulants at night help you with impulsivity, or would you recommend not stimulants? Stimulants at a right to just help with impulsivity. Would you recommend non-stimulant? I mean, it depends. They both can help with impulsivity. Both of them can help. You got to get out more. Now, I get out plenty. I just don't need to do it that often. But I get out plenty. You probably need to get out more. Why is my sibling zombie after taking his meds, lithium and Caplyta? Because those are mood stabilizers, and those a lot can be very slowing down as well too. So that's the thing with those two meds. Why do I hear voices of my name called out? Rip. Everything is going so quickly too. Why do I hear voices of my names count out in my inner head? Maybe it's your innie that's trying to talk to you. That's what's going on. Can anomalous self-experience, I don't even know what that means. Anomalous self-experience. I'm going to see my doc again because I'm scared. Why do I get brain zaps? I'm not sure. I'm not sure why you would get brain zaps. It's probably from nicotine withdrawal, TBH. If you're not on meds. Basically, any kind of stimulant can do it. Is it okay for me to take escitalopram when I take an L-triptan for my migraines? Yeah, that's fine. Those two can go together. It's not a big deal. The triptans they're serotonergic, but it's not like you're taking them every day. It's once in a while, so not a big deal. Your thoughts on people who still suffer from bipolar disorder, get treatment? I mean, yeah, that would be my thoughts, right? Yeah, I am a psychiatrist. Have you any advice for health anxiety? It's really taking a hold of me. I always get confused. What do you mean by health anxiety? Is that like you think that you're going to get some kind of condition, like a health condition? Or is it like anxiety seeing a doctor? Wait, but I still vape, LOL. Then yeah, maybe it could be that too. Maybe lack of sleep. I'm not sure. It's hard to say without doing further investigations. Thoughts on Spravato? It's good. I mean, I recommend it for treatment-resistant people. Not immediately, but for treatment-resistant. As a past surgical technologist, I like your enclosed glasses. Yeah, they're for dry eyes. Like that's the biggest thing. How do you feel about clomipramine when nothing else has worked? I mean, I like clomipramine. I use it for treatment-resistant OCD. I don't use it for immediate OCD, more for the treatment-resistant stuff. I don't think ChatGPT said you're gonna die. ChatGPT is nice. It wouldn't say that. Any advice for new PMHNPs? Yes. Try to learn and seek as much as you can. You don't know what you don't know, and you might also feel unconfident. And the only way you develop confidence is not by faking it, but true confidence is by developing competence. And you develop competence by getting the necessary life experience that tells you that you're competent. And the way to get that necessary experience is to seek out mentorship. So make sure that your collaborating psych is good. Make sure the place that you work at is good. Make sure that you seek out additional learning as well too, because that's the true way that you can build confidence and competence as a PMHNP, right? As when I graduated med school, we had residency, 4 years of residency, and then I had fellowship after. So like that's how I got mentorship, and that's how I developed confidence in my clinical abilities, is having half a decade of training after that. So that's the difference here. So yeah, that's what I would recommend. Do you guys hire PMHNP and FNPs with post? No, so I don't hire any PMHNPs. What I do is I have a coaching program where I teach PMHNPs psychiatry, psychopharm, psychiatric diagnosis, and also case reviews, case studies, basically helping with confidence, because I had so many people come up to me and like, for example, in these lives, and they were like, hey, can you mentor me? Can you precept me? Can you teach me? I had a lot of that. And the reason was because, I found out that a lot of people don't feel confident when they graduate. They don't feel like they got good learning. One of my students told me that she joined a new job and the collaborating psych barely talks to her, so she's all alone. Another told me that she sees 20, 25 patients a day, so she doesn't have any time to learn. She just like feels like she's drowning in it. Another one told me that he did a residency, like a 1-year thing at the VA, and he felt like that made a huge difference for him. So, I think the schools are quite frankly, they're scamming you, and they're just taking your money without really giving you the proper training, especially the online schools, and they're just pumping you out. So now, unfortunately, it's really up to you to seek out that training rather than just going through the system with it. I'm confused whether I have bipolar or borderline because the symptoms match now. Yeah, they definitely do match a lot. The symptoms match quite a bit. So with BPD, it tends to be more day to day, whereas bipolar tends to last more around like weeks or months. The changes tend to be slower. And bipolar, like there's probably a clear time where you can see it developing, whereas BPD happens more moment to moment and really from reacting to things. All right, we got 128 people in here, so we're popping. We are popping. Favorite med to treat ADHD? So typically you want to start with a stimulant. Stimulants are the first line for ADHD because they stimulate the frontal lobe, and the frontal lobe is the area of the brain that's the least deficit, basically, or that has the least amount of like flow. So while stimulating it, it helps with impulsivity, it helps with concentration, focus, all of that. What does guanfacine do for ADHD? It helps calm them down. It helps decrease a lot of the hyperactivity. So some people might be too active, and so it helps bring all of those down. I think I'm constantly going to be sick. It sends me into panic. That's not good. Should I stop vaping with ADHD? I mean, ideally, yeah. Vaping is just not good in general. But the reason that you do it, or people with ADHD are more prone, is because that stimulus, that stimulant, it stimulates the frontal lobe. And so by stimulating the frontal lobe, you promote focus just for a little bit. But then the problem is that nicotine lasts so small that it'll go up and then go down, go up and then go down. So that's the problem. So thank you for sharing your thing. Could you teach FNPs also? Yeah, we have a couple FNPs in our program, but typically we prioritize PMHNPs just because they're the ones who really want to learn psych in depth, especially from a psychiatrist. How does a psych decide when a patient's worthy of a case study? So Michael, thank you for the sub. So remember, if you sub, then I get to see your questions and prioritize them in more detail. And because then I get a notification that a sub's posting and like your stuff stands out. So definitely look at subbing. But Michael says, how do you decide if a patient's worthy of a case study? Basically, if their case is rare enough or there's something unique about their case that other people would want to know about. Case studies are they're a lot of work. So, and they're a lot of work for sure. And there's really not that much benefit to a psychiatrist to do them, in my opinion. Dr. Ranjnik says, history of PTSD, brutal relationship, history of working 2 jobs. Okay, man, we are popping here. We got 159 people, and we are cooking. We are cooking. Yes, these glasses are for dry eyes. Thoughts on stimulants and clomipramine? I mean, you can do them. If you're treating different conditions, they're just very stimulating together, so you might need lower doses of stimulants. Currently upping my Trintellix dose, got prescribed Klonopin as a rescue med. For how long is it safe? I mean, you can take it once in a while, it's fine. Typically, when you are starting SSRIs or SNRI, that's a good time to use it, and then you taper off. Thoughts on N-acetylcysteine? Yeah, I prescribe NAC to all my patients who have OCD. And so if you want recommendations on the supplements that I recommend to people, check out my TikTok shop. It's in my bio. Is quetiapine for... hold on. What's the question? Is quetiapine... I mentioned the nausea for years for my psych. She wrote me Zofran. Yeah, I mean, that's reasonable. That's, it helps treat some of the symptoms. Is Lexapro worth the risk if I have health anxiety, MD? Yeah, I mean, that sounds like that's what it's going to treat. Chelsea, thank you for the sub. What helps with sleep for people with anxiety and insomnia with that weight gain? Okay, L-theanine is super good for that. It doesn't cause any weight gain, and it helps with anxiety as well. It's really calming. I recommend it for people during panic attacks as well as for nighttime sleeping to really help calm things down for them. Magnesium as well. To magnesium, I like for body relaxation, and I like L-theanine for mind relaxation. So the combo is really good. Yeah, the combo is pretty solid. Can Lexapro be increased from 10 milligrams safely? Yeah, usually it goes up to 20 milligrams. So that's pretty good. Nothing else works. As bipolar, will I always have to be on my medication? So typically what I recommend is that people stay on for about 6 months to a year after they've had the last manic episode, and then they can slowly start coming down. But then if you start noticing the symptoms creeping back up, then it's a sign that maybe you weren't ready. What do you advise a person with high functioning depression? Maybe like lifestyle changes, right? And CBT as well. Because basically you probably have a lot of negative thoughts, and you got to try to correct all those negative thoughts. Would you be willing to take the medications you force on others? Nobody comes for force. They come to us for help. So we're not forcing them. People want help, and so we give them help. Do you know any infectious disease doctors? I do not, personally. Can a medical student be on Seroquel? Sure, why not? Why not? Your state of practice. So I practice in New York, but I have a bunch of state licenses across the country. So yeah, I have a lot of those as well too. So if you're interested in working with me as a patient or a client, definitely look at you can book a consult in my bio. That is the best way to do that, or to send me a link. If you want to book a consult, then I can message you the link. How many years of education do you need to be a psychiatrist? Yeah, so basically, I went to college, and then I went to med school, and then residency and fellowship. So I did college in 2011 to 2015, med school from 2015 to 2019, residency from 2019 to 2022, and then fellowship from 2022 to 2024. And then I did some other I did some other outpatient work after that, like learning functional imaging. So 13 years. Yeah, so it's definitely like a lifestyle commitment. It's not like just like a casual job you show up for. That is for sure. Okay, sub. So thank you for the sub. Apple user 429659. Our MAOI still prescribed? Rarely. I've only seen a couple patients on it. I mean, they're prescribed for depression, treatment-resistant depression, but only if they've failed a bunch of other stuff. That's the main reason that they're prescribed. I take L-theanine, L-threonate, apigenin. I still can't sleep. I would check the doses. Most people take too little doses. You can go pretty high on those, like 500, 600 milligrams for L-theanine and magnesium glycinate or threonate. Is it smart for a PMHP to go back to med school to become a psychiatrist? I mean, yes and no. I mean, sure, it'll get you another training, but I don't think it's worth it, because you can learn a lot of that stuff anyway, like if you have good mentorship. And like that's what I'm trying to do is I'm trying to teach NP psychiatry to make up for the to give you basically the education that I got from residency and fellowship and pass it on to you, because it's not your fault. If let's say I was a nurse and I decided that I wanted to become a provider, then it's a lot of extra work to go to med school and residency. And, quite frankly, my life path has been lined up around the nursing field. So, of course, I would go and become a nurse practitioner. Like, that's what I would do if I was in that situation. But then the problem you run into is that you don't know that the schools aren't teaching you, that the education is not as good as you would want it to be. You really have to seek out good mentors, good clinical mentorship on your own. The quality can vary depending on the institution. Like, that's not your fault. Like, you don't know that. And so because you don't know that, like if I did that, I wouldn't know that. And so it's not the NP's fault who get in this situation, because they want to go learn more, but do the best for the providers. So, imagine like they're all excited. I would be all excited to do that. And then you come out and you're like, what the heck was that? I just blew $50,000 and they didn't really teach me anything. So yeah, I had so many NPs come to me. That's what really led me to build my coaching program. So the best way to sign up, you can look at it through my bio, or you can just send me a message. That's the best way to do it. Just look it up in my bio, or send me a message. Rip, we got the questions popping. Yeah, so right now I'm only doing coaching. I'm not doing any preceptorship, but I will be doing some preceptorship stuff in the future. But it's only going to be for the students in my program, because those are students that I actually know and I trust their judgment, and I want to prioritize my own students, the people who are in my community, over just randoms. So if you're interested in getting preceptorship with me or getting mentorship from me, then our coaching program is definitely the way to do it. So you can either send me a message or do it in the bio. See it in the bio. How many years to become a psychiatrist? So as I already answered that, so that's 13 years, college, med school, and residency. But please do not spam again and again, because that's not a very good way to do it. and it's blocking other people. So a better way is to subscribe, because then if you subscribe, your questions will stand out more than anyone else. Okay, Danielle says, when would you recommend starting your mentoring program? I'm currently still in my didactic portion. We'll start clinicals in July. Yeah, so we have people both start as students, and we have people who start as they graduate. I would say actually it's better to start as a student, because then when you start clinicals, you will be in a much better position than if you only started than if you started afterwards. So I remember when I was in med school, anytime we start a new rotation like OB-GYN or surgery or psych, I would always do a lot of reading beforehand and learning, and that would help so much, because then when I got to the clinic, I would be so much more capable and confident, and I would have way more idea of what's going on, rather than not learning it until after, then trying to learn it after, and then looking stupid in front of my attending and things. So I definitely recommend starting it at the student phase. So if you're in that phase, so that way you can really start to hone in on your medication knowledge, your diagnostic knowledge. We do case reviews every week. We do question and answers every week, where we'll get on live calls and do that. And so that's the time to do it as well too. So you can learn from the live calls, and you can really learn how other psychiatric providers think, and how psychiatrists think as well too. I am applying this year for the match. How is psychiatry in the practical world? I'm worried. I mean, psychiatry is pretty much psychiatry is very competitive for sure, very competitive. But that's the game, right? Yes, that is the game. Damn, bro, how much is your rent? Definitely a lot, but it's worth it. I love living in New York. I love living in the city. Would you say Lexapro has real bad effects? 5 milligrams? No, not really. I don't think it has real bad effects. I'm starting. What's the worst that can happen to me? Probably the hardest thing is, at the beginning, it's just nausea and vomiting. That's the hardest stuff. Some people can have sexual dysfunction too, but that takes a little bit of time to come in. But at a low dose, ideally, I wouldn't expect it. But you don't want to be thinking what's the worst that could happen, because you'll probably manifest the worst that could happen. Yeah, so all the details are in my bio. So that's the best place to check it out, Brittany. So either you can send me a message and you can see it, or you can just check it out in my bio. That's where all the details for my program are. What are key things to look in a preceptor? Someone who really wants to teach you and is willing to teach you. That's the most important thing. And someone who has a lot of wealth of psychiatric knowledge. That's the thing, and they like to teach. Yeah, the same thing really, because a lot of my students have told me that they've had preceptors that they pay money for who barely do any teaching, and they're not available. So it's like, what's the point? And that was the reason I started my program. I was like, okay, this is a big problem, and we need to change this. Damn, we're popping. I love Lexapro helping me through nursing school. Yeah, one of my patients is also in school as well, and it's really helping her with anxiety. She's in NP school. What do you say to people with very bad social anxiety? You want to get exposure? Go ahead, get exposure therapy. Basically, you want to expose yourself to stuff. So for example, let's say you're scared of heights. Well, first you would start at the first floor, then you go to the second floor, then you go to the third floor, etc., etc. So it's the same thing for that. Yeah, man, it's not a pretty day, but it is what it is. What do you think about the injection in Vega? Yeah, in Vega's pretty good for treatment-resistant, like schizophrenia, people who don't really take their meds, and they need that antipsychotic treatment. We use it in the prison system a lot. We also used it for bipolar treatment as well, too. Why does no psychiatrist warn you that uncontrolled PTSD can lead to schizoaffective disorder? Because it does not. Those are separate entities. Is Psych getting more competitive? Yes, it is getting more competitive. For sure. It's definitely getting harder and harder to match. More people are applying. More Americans are applying. So it's getting way more harder for IMGs too. Vortioxetine versus other SSRIs. Yeah, I think of it more like a designer SSRI. So it tends to have more, instead of SSRI activity, it's got some like fine tuning activity for specific serotonin receptors. So it tends to have lesser side effects because it modulates the blunt release that pure SSRIs have. So they're definitely good choices. Less weight gain with them, less libido issues too. What if psychiatrist doesn't send meds to the pharmacy? You've been out for 2 weeks. Well, you definitely should reach out to your doc for sure. So yeah, definitely reach out to your doc. But that's the problem that a lot of my patients, so a lot of people actually come to me for second opinions, and they come to me from other psychiatrists because they're like, hey, I saw someone through Psychiatry, or I saw someone through X or Y platform, and no one was really doing, or like basically they would just talk to me for 15 minutes and prescribe a med real quick. And they felt like they weren't really getting to the bottom of things. So basically those docs are just insurance patients, like they have insurance patients. So they just do quick visits, and they literally get overwhelmed with patients. So if you want someone who is actually going to be able to spend more time with you and be able to really delve into your condition more, then you have to really look into someone probably outside of the insurance system, because they have less patients. And because they have less patients, they can spend more time per patient. Can BPD be treated only by DBT? Yeah, it can be treated by DBT for sure. But you can use I use mood stabilizers sometimes too. I have some patients who want more meds for their treatment because it's really affecting their life, especially if they blow up on friends or family, if they blow up on their job and they lose their job. Like, that's a problem. So it can help curb a lot of the mood lability. Describe the nocebo effect. Yeah, exactly. It's a big thing too, and that's why I don't recommend to a lot of people to be like looking up side effects and things. People always look up the worst things on Reddit and the internet, and then they expect that they'll have it, and they'll literally manifest those negative symptoms, like side effects, when they weren't even there in the first place. Or they'll perceive something as a side effect when it could have been a normal thing. So it's definitely a thing. That's why whenever you start something like a psych med or any kind of psych treatment, you always want to be thinking that, okay, this is going to work, this is going to be positive. Because then your thinking will only help you, and the placebo effect is going to help you instead of hurting you. Wow, yeah, we got 212 people in here, so shit is popping. Yes, people are definitely going hard. So yeah, definitely look at subscribing if you want me to answer your question and prioritize it, because right now we have so many questions that if you sub, then your stuff will it's going to stand out more than everyone else's, because there's a lot of questions here. So things are popping. I'm sure that the Gen Zers will have different terms, but I'm not a Gen Zer, so I don't know. I I feel like I can't keep up with the stuff anymore. Did you still have to do surgical residency? No, definitely did not have to do surgical residency. But we did have to do surgery rotation in med school, which was 8 weeks of pure torture. Who is most likely to get PSSD? So definitely check out our talk with Dr. Yosef. Dr. Yosef is a psychiatrist who's he's delving a lot into that, sharing some of the harms of psych meds. So we talked a lot about PSSD in that talk. It's like an hour-long interview. So if you go to my YouTube, then you can see that talk in there. Just search my name and Dr. Yosef, and then you will see it. Marcus Mom, I'm in the mentor group and highly recommend it. Oh, rip. Nice, yeah, I appreciate it. Yes, I'm glad that it's been good. Yeah, so I know I just literally got back from my conference yesterday and I'm leaving town. I'm leaving to another conference. I was going to post it in the groups. I'm going to Psych Congress next week. So Psych Congress Elevate. And so we're going to do our next call on Monday instead of Tuesday, just because I fly out on Tuesday. So we'll definitely do our call Monday night for the our weekly coaching call. So definitely drop your questions in there. And then I've been thinking about new lessons to put in there too. Two of the ideas that I had were lessons on augmentation, basically when to augment medications, and then also a complete guide to long-acting injectables. Those are the top two I'm looking at. Tips for coming off sertraline 50 milligrams. Yeah, just do it slowly. I mean, drop down to 25 and then go from there. Or you could drop down to 37, then 25, and then 12.5. What do I think about keto? Yeah, I'm a big believer in keto. I like keto a lot. I eat low-carb diet myself, too. I just find that carbohydrates, they fluctuate your blood sugar too much, and they make you hungry. They don't keep you full. Your blood sugar is kind of through the roof, so I'm a big fan of keto diet myself. I'm also surprised there's so many people here during the afternoon, because I always thought that people would come at nighttime, when they're at home chilling, but I find that my attendance is less around night now. Maybe I get like 100-ish, but then during the day now it's like a 180, 200. So that's pretty it's pretty crazy. It's morning in NZ. Yeah, we're all unemployed. Yeah. Join the club, right? Join the club. So right now I live the self-employed life, and yeah, it's been great. Pretty much I do my schedule whenever. I'm seeing some patients actually in about half an hour. So that's when I'll have to start doing my patient care things. But yeah, that's when I'm going to be starting the patient care stuff. So yeah, I love being able to choose my schedule. Awesome APA talk. Oh, I appreciate it. Thank you. Yes, I give a talk on physicians and healthcare providers getting onto social media. I think it's so important. It is so important. Quite frankly, there's we have so much knowledge and so much wisdom that this information needs to get out. Even if we just look at this live, this live is popping. So this info needs to get out there. Yes, we're jobless. We're bored at work. Yeah. Join the club. Join the the daytime club. Maybe I should be doing the live streams around day. Because when I first got started with this, I was doing my lunch streams. So I'd be cooking lunch, and then I'd wait for the lunch to cook, and then I would do it when I was eating lunch too. And then I haven't done it in a while because I was like, okay, maybe it's kind of weird doing it with lunch. But now I'm just like, okay, maybe I should just do it with the lunch. So still experimenting. Still figuring things out. Hi, I'm a PAC working in psych. Nice. This live is lit. Yeah, I love these lives, man, or lady. Yeah, it's I started a couple months ago, and I was like, wait, so you're telling me that I can just yap and by myself and create content, win W. So yeah, I think it's No, it's been great, and I think it's really helpful too. It helps you because you're able to ask questions directly, and yeah, and then especially bring back the salmon lunches. See, the OGs know the salmon lunches. That's what I had, in that's what I had today, of course, too. Of course, I had the salmon lunch, but yeah, maybe I should start showing that again. I think the thing is that I'm gonna be traveling a lot more, so I'm going out. I have a weekend trip, and then I'm going to a conference next week. So a lot of stuff going on there, but yeah. So definitely when I get back from the conference, we'll have to bring back the salmon lunches, or like I was doing a couple lives with other people too. Speak about the nocebo effect, people regarding claim to have PSSD. Yeah, see, that's a good point, Oliver. That's a good point. When you believe that you might have a side effect, then are more likely to manifest it as well, too. Because a lot of this stuff is so subjective. Like, we know that people with anxiety can cause themselves to have GI issues. So if they have anxiety that they're going to have a GI issue, they're going to think that they have. And then similarly for like a PSSD or whatever, just by being aware of it, you might think that you might induce that side effect and cause performance anxiety because you're just nervous during the bedroom, and because you might attribute it to med rather than confidence. I'm becoming a psychiatrist. Any general advice? I mean, I don't know what stage you're in, so it depends, right? Becoming a psychiatrist could be a high schooler, it could be a colleger, could be a medical one, could be a residency, right? Why psychiatry MS4 here considering psych? Well, if you're an MS4, wouldn't you already be applying? Yeah. And yeah, and like if you feel like we'd have started by now. Also, I feel like I'll tell you why I did psych, but I always say that, if I need to convince you to do psych, then psych is not for you. Yeah, so I get it. I did it because when I was in college, basically I had confidence issues and, wanted to be cool and popular. And like I felt like I wasn't any of those things. I was a young 18-year-old guy. And so I started getting more social, joined a fraternity, and started just changing around my life and going to parties and yeah, just hanging out with like cooler people basically at the time, because I just mainly hung out with my nerdy circle. And then I just had that realization that, hey, and don't get me wrong, like, I love nerds, I love games and things, but it wasn't helping me grow socially. So I realized that, hey, I can actually change my life if I do the right actions. And so if I can do this, then I can help other people do that too. And that just always stuck with me. And then, yeah, then I went to med school, and then that led me to psych. Like, I was pretty set on doing psych. Yeah, I was pretty set on doing psych. I was like either psych or family med, and I was like 70% psych anyway. So, yeah, we stuck with it. When are you going to New NV? I'm going to Vegas on Wednesday. So my conference starts Wednesday. Wednesday to Saturday we are going. Wednesday, yeah, Saturday. Staying at, staying at Caesar's Palace. No question, I appreciate the work you do. Thank you. What healthcare careers would you recommend to incoming college student? I mean, depends. There's so many. I want the medicine track. I mean, just because I wanted to be at the top. I wanted the most knowledge. I wanted to earn the most, and I was willing to put in the work to do it, and I didn't care how long it took. So, like, that's what I did. I mean, going back now, I would probably be a YouTuber, just because I think that healthcare is becoming more of a cesspit, and it's not the safe path that it once was, and there's so many other alternative careers to make money. Like, 20, 30 years ago, sure, like, there's not many other careers out there, like, safe, stable careers, but, like, I realized that I love business, I love entrepreneurship, and so I would have done something much more business-oriented, at least if I could go back in time. That's not to say I don't like what I do. Obviously, I do. I'm here yapping about it. I've made a TikTok channel about it, so clearly there is some interest, but yeah, I would have jumped into business quicker. But it's fine, right? You work with what you have, and so now I'm combining psych and business. Like, that's my main interest. I appreciate you giving knowledge and info to us, so helpful. Thank you, I appreciate that, Why don't more doctors do social media? Yeah, so that was actually my talk at the APA, the American Psychiatric Association. And the whole idea is that doctors have limiting beliefs. And limiting beliefs are things that they believe will stop them from basically doing action. A big one is overthinking. Big one is that no one's gonna watch them. They think it's unprofessional. They think it's that people aren't going to be on that it's not cool for doctors to be on social media, or it's cringe and things. And I think that may have been true at a time. And also I think another one is that doctors are raised in the employee mindset. So Robert Kiyosaki talks about this in Rich Dad Poor Dad, where if you're good at school, it teaches you to be an employee. It says, okay, do studying, take test, good boy, you got a good job on a test, now you get a good job, and then you work for the man in this good job, and then you retire at 65, and then you collect your paycheck and your pension. See, that's the mindset that doctors go through, and any providers in school, and especially in the medical field, because you do all this stuff in high school to get to college, and then you do all this stuff in college to get to med school, and then you're told, okay, now you have to do research and testing and standardized tests and interviews and stuff to get to residency and research, and then you do that, and then you have to told, okay, then you have to do that to get to fellowship, and you're told, okay, now you have to do more to get your job. So that's why. That is literally why. That's literally why they don't do it, because they're not trained like entrepreneurs. They're not trained to almost like really think for themselves. They're trained to just follow the system, follow the path. And it's only once you escape, once you see the matrix, once you like see the eyes and like you see that, okay, the role of an employer is to pay you as less as possible while extracting the most value out of you, the most labor, then you can't unsee it. And you're like, oh, like, so their job is literally to outwork me while not paying me and, not using my skill set as much. And so that applies to, doctors, that applies to NPs, any other healthcare providers, really. The system is designed to extract as much value out of you as possible. So I want to give control back to the providers. And, that's one reason I started my coaching program, was basically to teach NP psychiatry. So that way now you have control. You're not emboldened to, okay, you're preceptor and you don't have to go to one specific job just because that's where they might train you. If I can give you that training, that teaching, then you have a lot more flexibility to go where you want to, because you feel more confident with your skill set. Like, at least for me now, I know that I can go anywhere. If I wanted a job, because of my psychiatry training, I can get a job anywhere. And especially as a child psychiatrist, I'll get hired anywhere. So I already know that I have that. But I can do that because I've built that confidence from med school, residency, and fellowship. And so that's what I do with my NP students as well. Like, I want to build that confidence in you, so that way you feel good with patients. You feel like, yes, I know what I'm doing. And then you can go anywhere in a good practice setting and be like, okay, I can handle this. Yeah, that was a big yap session for sure. So Valerie, thank you for the sub. Other than CBT, what are the best things someone with OCD can do for themselves? Well, you can do exposure response therapy. You can take N-acetylcysteine. Basically, the way that exposure therapy works is you give yourself exposure to the thing, but then you don't follow through with it. So, for example, one of my patients tells me that whenever he leaves the room, he has to turn off or like touch all the 4 walls and then turn off the light switches a couple times. So what he's doing now is he's giving himself exposure to the distress where he leaves a room, and he's saying, no, I'm not going to touch the light switches. I'm not going to touch the walls. And that's exposure now, exposure and response prevention. So he's feeling the distress, but he's preventing the response from happening. My mom was a doctor, loved her community, but not the politics. Exactly. Are there any other medication for BPD? My venlafaxine doesn't seem to be working anymore. Venlafaxine isn't really for BPD. It's more for depression, anxiety. So many sirens. Are you in New York? I am, yeah. Literally, like, all I hear are just police sirens all day, every day. Like, I become so desensitized. It's not even something that I think about until people mention it. But I remember the worst time was during New Year's. I mean, all my friends went out, my roommate went out, but I didn't feel like going out. So I stayed at home. I actually played Marvel Rivals at New Year's, no regrets. But sirens were the whole night, just sirens, boom, boom, sirens were going on. And the street in front of my apartment was literally packed, just completely packed with stuff, yeah. Natalia, congratulations. I have 2 years under my belt in Psych RN, now going for NP. Tips, what's your coaching program like? Yeah, so basically what I do is I want to teach the fundamentals of psychiatry to my students, to NPs. And what that involves is teaching psychiatric diagnosis, how to do a clinical interview well, for example, like taught by a psychiatrist, how to do it really well, how to be able to find out what the diagnosis is with the patient, how to start the right treatment, how to know which diagnosis you're dealing with by knowing the ins and outs of the diagnosis, know how to treat all the diagnoses, for example, depression, anxiety, catatonia, etc., knowing all the things. And then we have a module in every single medication, every single psych med. So if your patient's on Cyprexa, okay, you can look it up and you know what dose to use, how it works. If you're thinking of starting Cymbalta, you can look it up and be like, okay, I start with X dose, I use it for this indication, etc. And then I also have case studies as well, where I break down real life cases that I've worked on and share what I've learned in these cases with you. I have a module on supplements where I discuss the most top used supplements in psychiatry and how to use them. And then we do Q&As. And the Q&As are, I think, the best part, is because then people will ask me real life questions, like real life cases, real life discussions, real life psych questions, and then we answer them live on a call. So that way you can literally ask a psychiatrist for feedback. So instead of working with some shitty preceptor who barely answers questions, or some collaborator who just takes your money and doesn't do anything, you get to be part of a community where you actually can ask questions and get answers to them. And like, people ask questions in the community all the time, and people will even other people will answer them. So it's very helpful as well. So if you are an NP and you're really interested, Psych NP, and you really want to level up your psych skill and your psych confidence, then this is the program for you to do it. You work with teens or adults? Both. OMG, you seem cool. I went to 6 psychiatrists now, then my city's good. Won't even kick me out. She couldn't handle it anymore. Yeah, I definitely don't get along with a lot of the mainstream psychiatrists. Like, plenty of them don't like me, or they've unfollowed me and blocked me and stuff. But and because, like, I feel like I just talk things different. I'm not really academic. I'm not really obsessed with research and things. I'm more, I guess, young and a bit more casual, I guess. But hey, that's why I really like social media, is because I can just put myself out there authentically now, and especially now because I have, I don't have an employer, so I don't work for anyone. And because of that, I can just put my authentic self out there, and then the people who vibe with it, and then the people who don't. And so it's perfect. It's literally perfect. Hardest part of psych, it's the ambiguity. A lot of people don't like the ambiguity, especially a lot of medical people, because you want it to be very structured, right? You want the patient has X labs, so they have blood sugar of 500, okay, they're in DKA, and then I need to give them insulin. Like, they like the objectivity. Or, okay, you have this marker, so you have this kind of cancer. Well, psych's not really like that. It's a lot more objective, or unobjective. It's a lot more touchy-feely, and it's like combining the science, but the art of it too, the uncertainty. Like, different providers will be able to see the same patient and come up with different treatments, and that's not usually the case in other things. So you have to be okay with all of that. How do I make my Vyvanse work better? Sleep more. That would be the thing, the number one thing, honestly. I'm a current MS1. We'll do psych residencies, look for applicants to match. I mean, I was on the residency committee, basically a dedication to the field, good letters of recommendation, good personal statement, interest and commitment to the field, like your application is psych. A red flag for me is if I see your application's all surgery or cardiac or something else, it's like, are you dual applying? Did you decide last minute, etc., etc. Protein, yeah, protein too. Protein makes more amino acids, especially L-tyrosine. So definitely going on a lower carb diet, higher protein diet is helpful. For sure. Do you believe in plant-based medicine? I assume you're meaning greens. I think it can help for some chronic pain, but in terms of mental health conditions, long term it may not be the best because people get hooked on that stuff. And yeah, there's definite issues with greens too. Tolerance is a big one. Yeah. Can Wellbutrin cause hair loss? Not really. It's not really known for that. Depakote is. Do you recommend starting your program in the second year of NP when we're in clinical or post? I would say right before clinical is a good time to do it because you want to be able to reinforce what you see with the patients of real life so that way you can come back and ask questions and really learn the practical application of psychiatry. How long is your coaching program? Is it online? Yes, it's online, so you can check it out in my bio. Yeah, it's all online, and yep, it's in my bio. So you can definitely check that out. It doesn't have a certain duration. You can stay as long as you want to, but that's why people are signing up for the yearly membership because they're like, because they're getting a lot of value out of it. So it's super helpful. Do you think it's right? Because you're always going to be seeing patients, and then as long as you're seeing patients, you always want to be able to reference things and come back to the community. Do you think your program is helpful for PMHNP students or only for postgrads? Both. So we have a lot of students, and in fact, I recommend it to students because that way when you graduate or when you do your clinicals, you're going to be way more prepared than someone who hasn't done that. Right, yeah, we got 189 people here. So we are popping. Guess we're all taking breaks from work, huh? Me included. I have a patient who's coming in and can Wellbutrin cause swelling in the lower legs? It's usually unheard of. Would it be beneficial in med school? Would what be beneficial? My program, I mean, it would be somewhat, but it's more for NPs in med school. Like if you're only going to do a psych rotation for a month, so I wouldn't say it'd be helpful then. It'd be helpful as a resident though, or if you're really committed to psych. Should I work out or sleep? Definitely sleep. Definitely sleep. Sleep is important. Will my husband's BPD1 diagnosis pass on to our kids? It can. Yeah, I think it's got like a 50%. It's got a 50% pass or genetic rate. So it's definitely important to be aware of. England, it's nighttime. Oh, interesting. Yeah. How do you deal with a new chronic illness when you're healthy your whole life? Yeah, you have to maintain the health for sure. Maintain the healthy diet, maintain your sleep. Do you expect MHC practicum students for internship? No, I do not. Right. yeah, I think if you want good quality healthcare, then you have, unfortunately, it does require usually to go out of network, because the problem is that any in-network doctor or in-network psychiatrist, they will just get swarmed with patients, so they'll only see patients for 15 minutes, and they'll just kind of pump them out. They work by a pump out model, whereas someone who's out of network will spend more time with the patient, really delve deeper into things. So it depends if you want quantity or quality care. And so that's why, I wanted to do quality care. So that's why I knew that I had to go out of network and I had to really delve a little bit deeper to be able to give patients more quality. All right, we got a couple minutes left. I have, I have a patient at 4:30. So let me just send them an invite. And yeah, so why don't we